Obamacare was lousy health care, always was. It's not very good today. And what I said, that if we come up with something, and we are working on things, we're going to do it and we're going to replace it.
So Donald Trump is now saying he's going to kick millions upon millions of Americans off of their health care. I'm not joking. Like, he just called to terminate health care for millions of Americans. This is insane.
After voting against Obamacare, MAGA FAFO season is upon us because MAGA Trump supporters effed around, and now they're finding out that Obamacare is the same as the ACA, the Affordable Health Care Act, which now those who are benefiting from this Affordable Care Act voted against Obamacare, thinking that Obamacare was for black people and poor people. Now they're finding out that they do not have universal health care in their hand. Let's get into it, guys. I'll be back with more commentary after this.
I talk a lot of shit on here. I share a lot of shit. I share my opinion on a lot of things. And I get 95% of that is a distraction from the right about the shit that they're actually trying to do, right? But there's one thing that I still have to ask, like, why the fuck are we talking about Greenland and Mexico and Canada and Panama when I thought we elected this motherfucker? Well, you guys that voted for him elected this motherfucker to focus on the United States. Why the hell is he focusing on the rest of the fucking world and not on us? Why won't somebody give us fucking universal health care? Because none of the other shit that they're trying to pass fucking matters. He's trying to give all this shit to corporations, right? You know what would make corporations happy? Healthy fucking workers that actually come to work. Healthy workers that aren't going to die off when they're 60 and can keep working till they're 80. If you want to make the corporations happy so they can keep exploiting the U.S. workers, give us fucking universal health care, Trump. I don't care if Trump passes it, the Democrats pass it, anything. There's no reason in hell that my dad spent 6 weeks in the hospital before he died, and after insurance, the bill was $358,000. If he wouldn't have been 100% covered by the VA to write off the rest of that bill, that would have gone to my mother in the state they lived in. All of his medical debt would have transferred. My mother now has breast cancer. And just a year and a half after my dad died of cancer. Go figure, right? Fuck that. Why in the fuck is she going to be looking at, because she's not a veteran, she's not covered by any of that plan. She's probably going to be $40, $50, $60,000 in debt by the end of the year just to cover her cancer treatments. Why the fuck is this a thing? We're the only industrialized society without some form of universal health care. And yet, here we are talking about buying fucking Greenland and Canada. Now, fuck off with that shit. Come back and talk to me when we actually have some real health care.
You don't have a right to free healthcare because healthcare requires other people's labor, and you don't have a right to other people's labor.
Hey, Evan, quick question for you, buddy. Who's asking for free labor?
You don't have a God-given right to anything that requires other people's labor.
Yeah. What's your point?
Oh, health insurance is so corrupt. They shouldn't be profiting off of people's healthcare needs.
Yeah, that's generally the idea. And just because you put it in air quotes doesn't mean it's a bad idea, so.
Okay, then how should it be done?
I don't know. Ask any number of these countries. 69% of the world population is covered under universal health care. So it's not like it's a secret. And notice how it says that the United States is the only developed country in the world without universal health care. So, they've figured it out elsewhere.
Because there has to be an incentive to do that very specialized work of allocating scarce healthcare resources.
Are you under the impression that doctors in countries that have universal health care don't get paid? Do you think that's how it works? Do you think that they're all just working pro bono? And for you, like if you have health insurance in this country, United States, you go and get, let's say, a physical that's covered under your insurance. Do you think the doctor doesn't get paid for performing that physical on you? It's the same thing in countries with universal health care. It's the same thing. You're not paying at the time of the service, but you're paying for it. So I ask you again, who's asking for free labor?
And when it gets done by the government, it doesn't get done very well.
You sure? See, this is what happens when you see an Elon Musk tweet and just regurgitate it without actually doing any research. Let me show you something. So let's just look at administrative costs for private health insurance compared to Medicare, right? Private health insurance administrative costs is estimated to be about 15 to 30% of medical spending. And this is administrative costs for private health insurance, right? So that's 15 to 30% is what they spend on administrative costs. Now, let's look on what Medicare spends on administrative costs, because they both options will have administrative costs, right? 2%. 2% compared to 15 to 30%. And spending on providers, Medicare pays hospitals 40% less and providers 2 to 3.5 times less than private insurance for the same services, which means you pay more for private insurance. Expenditure per enrollee, Medicare has been able to limit growth in expenditures per enrollee more effectively than private insurers, and the CBO has predicted that the rising cost of private insurance will continue to outstrip Medicare for the next 30 years. So no, the government does health insurance pretty well, better than private insurance at least, and that's the only other option. So comparatively, government health insurance is much better.
You guys can't even explain why you believe health insurance is supposedly so corrupt. You just say that because everybody else in the comment section is saying that.
That's actually hilarious, coming from someone who saw Elon Musk tweet and decided to make a TikTok about it without having done any research on the topic to begin with. You and about 1,500 other right-wing TikTokers on this app. So next time, do a little bit of reading, right? Do a little bit of research. Please don't take what Elon Musk says as face value, because he's usually wrong. Yeah, I hope that helps for next time, okay? Thanks, Evan. Cheers.
People are not going to fucking believe this. Just yesterday, I made a video saying that we should have had Medicare for all in this country 80 goddamn years ago. And the only reason we don't is because every single one of our health insurers are greedy, blood-sucking fucking parasites. Well, just this morning, I woke up to an email from my health insurer, Anthem Blue Cross Blue Shield. In that email was an explanation of benefits saying that I owe $12,000 for some lab work I had done back in September. Now, it's true, in September, I had a doctor's appointment, and when I made that appointment, I was very careful to choose a doctor that was in network at a place that was in network. During that appointment, they said, hey, do you want to do some lab work? I said, yes. I thought it was fucking part of it. No one explained that it was going to cost me $12,000 to get this lab work done, and the lab that they used to do that lab work was apparently not in network. And now I owe $12,000. All right. For 12 grand, I could fly to Paris, get the lab work done, spend 3 months in Paris doing whatever it is Parisians do, eating baguettes and sighing non-committally, I guess, and then come back to the United States. This entire country fucking sucks. Everything about it is a goddamn con designed to take money out of your wallet and put it into the wallets of people who are vastly more wealthy than you could ever goddamn imagine.
American healthcare sucks. So much so that Donald Trump can't even come up with a good lie as to how he'll fix it. Remember this?
Yes or no, you still do not have a plan?
I have concepts of a plan. I'm not president right now.
I mean, we have health insurance CEOs being unalived and people are celebrating it. And that's really bad, but it's also indicative of just how bad the healthcare industry is in this country. Now, a lot of you don't know this, but this is actually the industry I work in, so I want to take a little bit of time to explain exactly why this is the way it is. This video is going to be a little longer than usual, so if you don't really give a shit about this topic, that's totally fine. Move on, but I'm going to jump into the explanation. Even if somebody like Bernie Sanders were to be president, it would still be extremely difficult for him to get Medicare for all to become what happens in this country. But why is that? At the top level, it's because the for-profit model is so ingrained into how healthcare works in this country that it will take so much effort to undo it. From just a structural perspective alone, it would cost billions of dollars to get it done. It would disrupt multiple industries and displace hundreds of thousands of jobs. So you would need a plan to offset some of those problems, which nobody has brought to the table, including Bernie Sanders. Then you run into the issue of demand. If you were to give everyone Medicare level health insurance at the same time, the demand for care is going to skyrocket. And the problem is we currently have just enough personnel to handle the current demand. If we were to exponentially increase it very quickly, it would be completely untenable. So a big part of this plan would have to be incentivizing and paying for a lot more people to become doctors and nurses, which is a good idea, but will take a lot of time. Because even if you create the funding for that law, you still have to recruit people to then go into the system, and medical training takes many many years. So this is something that will not just be able to happen overnight. Then you run into issues with research and development. The majority of research and development in this country comes from big pharma. And trust me, I know big pharma is a for-profit, business-first, people barely second industry. But they are the primary drivers of healthcare getting so successful that people are living longer because drugs are getting better. That is also them. And much of their profit comes from their ability to innovate and then sell those innovations. People always complain that drugs cost a lot of money, but drugs cost a lot of money to create. Developing a drug is a many years long process that requires a ton of trial and error and a ton of money. So in a Medicare for all type system, instead of charging customers the price to make up for the investment they made, they're going to charge the US government. So essentially that means that the US government would be in charge of deciding what gets research and development funding. That could be good in some ways and it could be bad in some ways, but unquestionably what it will mean is that it will bog down the R&D process into government bureaucracy. And in all likelihood, politicians would have a say in what is going to get funded for research and what is not. And that is inherently a bad idea. So in essence, you're moving the decision of what gets research and development funding from corporations that have the demand of the market to government organizations and politicians that are trying to save money. Both ideas are bad just for different reasons, but if you switch it to being under government control, there's no question that R&D innovation will slow down. Now, none of this should be taken as defense of our current system because our current system sucks. Medicine should not be a purely profit-driven enterprise, which it pretty much is right now. But as voters and citizens of this country, we need to be aware of what is realistic and possible. And just electing somebody like Bernie Sanders and flipping a switch to Medicare for all is just not a feasible outcome. This is like Donald Trump's mass deportation plan. I mean, all his followers really like it. They think it looks great on paper, but then you get into the details of how it works and you look at it and go, what the fuck are you talking about? You can't do this. And if you just rush it out, it's going to fail, which it is. Medicare for all is the same thing. The outcome in the end is possible, but getting there and how you get there is very different from what's being pitched. So what do we do? You're not going to like this answer, but it's one little piece of the puzzle at a time. A great example of a first step was Obamacare making it so insurance companies could not deny people based on pre-existing conditions. So next we need something like an out-of-pocket maximum so people can't go bankrupt because they get cancer or something like that. Something where the government kind of jumps in when you've hit a certain amount. So say it's $30,000, I'm making this number up, but say you spent $30,000 out of pocket in 1 year and the government comes in and goes, okay, you're done paying, we'll take care of the rest. Another example would be taking prescriptions and applying that same system to it, an out-of-pocket maximum. Kamala Harris actually had that in her plan, so we missed out on that opportunity. So once you've established circumstances like that as our baseline functionality in healthcare, then it's much easier to transition from that to a full-on Medicare for all system. Because then you're not creating this shock to the system where you take a for-profit model and flip it to be Medicare for all. The healthcare system would just be more used to how Medicare for all would function on many different levels, so it would be able to make that switch more easily. But unfortunately, people are impatient, idealistic, and easily frustrated. So these sorts of small steps are unlikely to be popular ways to approach this. People want that full spectrum switch, but that is just inherently a terrible idea. The goal of it is not a problem. The goal of it is great. Everybody in this country should be getting the healthcare they need, and it shouldn't ruin their life as they attempt to get it. But unfortunately, we are entrenched in a for-profit model that is going to be very complicated to get out of. Any piece of legislation that tries to undo it quickly will fail. And it's not because it's going to fail the vote, it will just fail functionally. We want this system to work in the long term for this country so people can get what they want. The best way to do that is like anything else in life, small steps that amount to a big change over time. I know that sucks and it's annoying and boring and frustrating, but that's the reality. And anybody who tells you differently is just not understanding how deeply complex this situation really is.
The healthcare system that you're saying sucks is Obamacare. We told you this would happen.
Shit. She got us, you guys. How do we put this in terms that they can understand? Let's say you are in a critical thinking class and you're obviously failing it. Then in the fourth quarter of the class, you do a little bit of extra credit and you improve your grade from an F to a D. You get your report card at the end of the year and the teacher says you got a D. And you go, I should have never done that extra credit. You don't blame the little improvement for the reason why it's bad in the first place. Obamacare is a set of pretty basic regulations. It is not a healthcare system. Obamacare just said, no more pre-existing conditions clauses. It said you can't charge people more because of their genitalia. It said no more policy maximums, which says that the policy doesn't have to pay anymore if you're too sick, along with a couple of other very basic regulations that made it so that people couldn't just be denied coverage because they were unlucky. And they balanced that out with a requirement that everybody has to be covered. It's the only way that insurance can actually work. Now, I know whiny McDrunky Pants turned this video off like 45 seconds ago, but in the off chance that any other MAGAs are still here, congratulations, I love you, and I hope you have access to healthcare.
I don't think people understand what a healthy society needs in order to thrive. Because I've seen a lot of people making the argument that Americans don't deserve free healthcare because healthcare requires labor, and you can't force people to work because that would be slavery.
You don't have a right to free healthcare because healthcare requires other people's labor, and you don't have a right to other people's labor.
And they say this as if healthcare workers wouldn't be paid under a universal healthcare system. 73 countries operate under some form of universal healthcare because in a healthy cooperative society, they understand that a healthy population is better for everyone. Anyone who is working paycheck to paycheck, which is 66% of the population, is a slave in this capitalist society. A system that prioritizes profits over people is slavery. And the United States is the model of a country who puts profit over people. Like, what kind of MK Ultra brain control program must you have undergone to argue against free healthcare? You're basically saying you think your tax dollars are better off in the pockets of billionaires than going towards programs that benefit society. You're saying that you are perfectly fine that the ruling class has designed a system where virtually everything is free to them and is all paid for through the exploitation of you and I. The amount of people who fight against their own best interests and the betterment of society is astounding. The billionaire worship by people who are making the minimum payment on their credit cards every month is horrifying. Listen, man, you are not going to ever be a billionaire. And the billionaires are never going to put your interests before theirs. Hoarding unlimited wealth and resources doesn't make you a good person. It's not noble. And it doesn't benefit society. It shouldn't be an aspiration. Society needs healthcare. Society needs education. Society needs food and shelter. And society needs good people. We don't need greedy billionaires.
So the numbers are out, and Republican voters signed up in droves, in record numbers for the ACA. Yet they voted for legislators who said their number one issue is to repeal the ACA in 2025. And now that our premiums have gone up and co-pays have gone up like they do every year, they say they don't want universal health care. Yet the health insurance companies made billions and billions of dollars last year in profit. Not to mention the millions of dollars in CEO pay and bonuses. Because, yeah, it's so hard to deny people health care all day. They need millions of dollars to do it. So while they fly around in their private jets and pick out their latest summer house, the rest of us are left with inadequate healthcare insurance. How they have convinced people that universal healthcare is not the solution to our problem, I'll never know. All of that money going to healthcare insurance companies should be going back to the people who need it. It should be going into care, into prescription drugs. There is no need to have a for-profit healthcare insurance system in this country. It's absolutely insane. So our job this month, when they start to introduce legislation, is to get loud and make sure people know what they are planning on doing and how it will affect us and our family members. So be loud.
You know, one good thing that came out of this whole Luigi United Healthcare issue is people are finally starting to talk about the healthcare system in America and how messed up it is. What I don't think people realize is a lot of their issues is because of Obamacare. Yes, Obamacare had a lot of good ideas, but it didn't work for the vast majority of Americans. What it allowed was for people with pre-existing conditions who used to not be able to get health insurance, and people who couldn't afford health insurance at the time to be able to get health insurance, which is awesome. However, because of that, the insurance companies had to raise their premiums for all of the other people outside of those two circumstances. So if you didn't meet the eligibility financially for Obamacare, and if you didn't have pre-existing conditions, your insurance rate skyrocketed through the roof. That's the part of Obamacare that people don't talk about, because when you hear Obamacare, you hear about the Affordable Care Act, and made health insurance affordable, only made health insurance affordable for people who couldn't afford health insurance to begin with. For the people who did have insurance already, it just made them skyrocket. So the majority of middle-class Americans are paying for that.
Can we all agree on something? It's something really simple, and none of us should have an issue with it. Can we all agree that we will never trust anyone who would rather cut funding for Social Security, healthcare, Medicare, housing, education, feeding the poor, and feeding the hungry before they would tax the wealthy and the big corporations?
I'm sorry, man. This real life? This can't be real life right now. So I just saw the video of the guy who was saying that he voted for DT because he was going to get rid of Obamacare. He didn't like Obamacare, and he was voting to get rid of it. And he said he wasn't worried because he's unemployed, he's on disability, he's disabled. And he got his insurance through the Affordable Care Act. And when he said it, the guy was like, you know those are the same things, right? And the look on his face, I kid you not. So he spazzing out like, why would you name them two different things? So the guy's like, you literally voted to cancel your health insurance, the thing you depend on right now. God, I can't believe, like, this is what I'm looking forward to personally. The lives that are going to come over the next few years. This is what I'm looking forward to. This is my silver lining, because the jokes are just going to write themselves over the next couple years. It's funny, but it's not funny. Especially, working in healthcare, working as a healthcare provider, I understand how important it is for people to have their insurance to be able to take care of themselves. But I'm sorry, the literal definition of voting against your own best interest. You have insurance through the Affordable Care Act, but you voted to get your insurance canceled. This can't be real life.
Here's something Republicans don't want you to know about. It turns out that when my husband retires, we'll be paying less money for health insurance than we were paying under his employer's health insurance plan. You know why that is? Obamacare. A lot of folks don't retire early because they don't understand that Obamacare can possibly provide cheaper health insurance than what they're currently paying. And we know that in this country, health insurance is tied to your employment. What do I have to say? Thanks, Obama.
Alright guys, there you have it. We all know how MAGA think upstairs, because most of them actually followed Donald Trump blindly without doing any research about the policies and the campaign promises that he was actually making, by promising them to remove Obamacare and saying that it was causing a lot of harm to their pockets, and then that Obamacare was a bad thing. Many people thought that Obamacare was for black people and poor people. Now they are finding out that they lost their universal health care that was actually benefiting a lot of them, a lot of their family members, a lot of their friends actually, because right now the healthcare system in the United States is actually meant to rip people off, to make people go bankrupt. We have seen in the video that you can actually spend as much as $12,000 US, which actually is very absurd considering how the man who was comparing it to going to France or to Europe, he would actually go and do a lab test for only $3,000 and actually use the rest for a vacation. It's absurd how high and costly the healthcare system is in the United States. So MAGA Trump supporters were actually out there crying out, "Make America Great Again," voting against Obamacare, not knowing that Obamacare was the same as the ACA Act. Now they're crying online because many of them are no longer gonna have a universal health care that will help them to actually be healthy. And we have seen in the video, guys, so many people are making the point, why doesn't the United States healthcare system invest in its people? Because, when you have a healthy workforce, the economy is actually better off, as they do it in Europe, we all know that many Europeans always actually boast about their healthcare systems when they're comparing their benefits with the American benefits from the government. Even our friends up north in Canada, they have a healthcare system. It seems like only the United States, the most powerful country in the world, the largest and biggest economy in the world, seems to be the only one that do not have a universal healthcare. So guys, what do we say to this? We say, MAGA, you effed around. Now you are finding out. The only crazy part and the only hurtful part is that MAGA is gonna be finding around with the rest of people who actually did not vote against Obamacare, who did not vote for Trump. So many of the Trump policies that actually he promised to be doing, he has actually backed down from them. He has said in interviews that it's not gonna be easy for him to lower the cost of groceries because once the prices go up, it's not easy to bring them down. So he was actually counting on MAGA being dumb for them to vote for him without doing any kind of research. Let me know your comments in the comment section below. Like the video, subscribe to the channel. Thank you very much for choosing us today. See you on the next episode.